When Jamaica gained its independence in 1962, the nation faced enormous challenges, none more urgent than the health and well-being of its people. At that historic crossroads stood a physician, a policymaker, and a visionary whose work would shape Jamaica's healthcare system for generations. This is the story of Dr. Herbert Wellesley Eldemire, doctor, pioneer, and Jamaica's first Minister of Health. Herbert Wellesley Eldemire was born on October 16, 1930, in Montego Bay, Jamaica. Growing up in Western Jamaica, he was shaped by the realities of community life, where access to proper healthcare was often limited and medical services were stretched thin. He attended Monroe College, one of Jamaica's most prestigious secondary schools, where discipline, leadership, and service were deeply ingrained values. Even in his early years, Eldemire showed a commitment to excellence and a desire to serve others, traits that would define his life's work. Driven by a passion for healing and service, Eldemire pursued medical training at the Royal College of Surgeons and Physicians in Ireland. At a time when few Jamaicans had access to advanced medical education overseas, this achievement marked him as part of a new generation of Caribbean professionals prepared to bring global expertise back home. Upon returning to Jamaica, Dr. Eldemire established a medical practice in Montego Bay, where he served patients for over 40 years. His work went far beyond routine care. He treated generations of families, earning trust not just as a doctor, but as a pillar of the community. He later founded the Herbert Eldemire Hospital, a private healthcare institution that expanded access to quality medical services in Western Jamaica and strengthened the region as healthcare infrastructure. In 1962, the same year Jamaica gained independence, Dr. Eldemire entered national politics. He was elected to Parliament representing St. James Northwestern as a member of the Jamaica Labour Party. That same year, history was made. Dr. Herbert Eldemire became independent Jamaica's first Minister of Health, serving from 1962 to 1972, a decade that would prove transformative for the nation. As minister, Eldemire was tasked with building a healthcare system for a newly independent country. His approach was bold, forward-thinking, and deeply rooted in preventive care. One of his most significant achievements was the introduction of the National Family Planning Program, a groundbreaking initiative that helped families make informed health decisions and improved maternal and child health across Jamaica. He also championed the expansion of medical infrastructure, including the development of the Cornwall Regional Hospital and the Cornwall School of Nursing, ensuring that Jamaica not only had hospitals but trained professionals to staff them. Dr. Eldemire's leadership extended beyond the Ministry of Health. From 1967 to 1972, he served as chairman of the Jamaica Labour Party, helping guide national policy during a critical period of Jamaica's post-independence development. In 1976, he returned to Parliament as the first Member of Parliament for St. James East Central, serving in opposition until 1980. Whether in government or opposition, Eldemire remained a consistent advocate for public health, social development, and national progress. Beyond politics, Dr. Eldemire's medical contributions were nothing short of historic. He played a crucial role in establishing the first kidney dialysis unit in the Caribbean, a breakthrough that saved countless lives and placed Jamaica at the forefront of regional medical innovation. This achievement reflected Eldemire's belief that Caribbean people deserved world-class healthcare without having to leave their homeland. His commitment to accessibility, innovation, and compassion transformed medical care in Jamaica and inspired future generations of healthcare professionals. Dr. Eldemire was a family man, married with 4 children. His daughter, Denise Eldemire Shearer, was married to Hugh Shearer, Jamaica's Prime Minister from 1967 to 1972, further connecting Eldemire to the nation's political history. Despite his national prominence, he remained deeply rooted in Montego Bay, where he lived and served for most of his life. On May 20, 2010, Dr. Herbert Wellesley Eldemire passed away at his home in Reading, St. James, at the age of 79. Dr. Herbert Eldemire's legacy is etched into Jamaica's healthcare system in hospitals, policies, training institutions, and lives saved. He was a rare figure who bridged medicine and governance with clarity of purpose and unwavering dedication. His work reminds us that true nation-building begins with caring for people's body, mind, and future. Dr. Herbert Wellesley Eldemire was more than Jamaica's first Minister of Health. He was a healer of bodies, a builder of systems, and a visionary who believed that quality healthcare was not a privilege but a right. His legacy lives on in every Jamaican who benefits from the foundations he helped to build. His life reminds us that one individual armed with vision, compassion, and courage can change the course of a nation. From the doctor's office in Montego Bay to the halls of Parliament, his work laid the foundation for modern healthcare in Jamaica and across the Caribbean. But stories like this only live on when they are told. If you found value in this story, like this video, share it with someone who needs to hear it, and subscribe for more powerful stories about Caribbean pioneers, history, and global impact. Let us know in the comments who is another Jamaican or Caribbean trailblazer whose story deserves to be told. Your support helps preserve these legacies, educate future generations, and keep our history alive. Until next time, honor the past, understand the present, and build the future.